Good evening, everyone. I'll be presenting a tale of two traumas, which is comparing the visual outcomes in closed globe injuries with and without head trauma. Ocular trauma has a wide variety of presentations, ranging from a contusion to a globe rupture, and patient presenting with a vision of 6/6 to a patient with no perception of light. Our aim of the study was to analyze the influence of head trauma in the visual outcomes of patients with ocular trauma. We included only closed globe injuries. It is a cross-sectional study of duration 3 months. Our study included 300 patients who had ocular trauma or closed globe injury, out of which 150 patients were divided into group 1, who had a concomitant closed globe injury and head injury, and the other group 2 had only closed globe injury. Age group of 18 to 65 years was included. Patients with severe head trauma, GCS less than 9, and open globe injuries were excluded. Visual acuity during the first presentation of the trauma and at the end of 2 months was recorded. We took into account the factors like head injury, a lid injury, and bony orbital wall involvement, and their influence on visual outcomes in both the groups was analyzed. Coming to the results, the age in both the subgroups was a younger age group, less than 30 years, and a male preponderance was noted in both the groups. The major causes of closed globe injuries in both the groups was road traffic accidents. The patients who had ocular trauma and a concomitant head trauma presented with papilledema being the most common, whereas in group 2 it was a subconjunctival hemorrhage. We also found an impact of GCS on the visual outcomes, in which patients with mild head trauma, that is GCS more than 12, 56% of the patients showed a visual acuity improvement, whereas in patients with moderate head trauma, only 38% of the patients showed an improvement in visual acuity. Visual outcomes in patients with papilledema, in group 1, 27% of the patients, and in group 2, all 100% of the patients showed an improvement. Here, we also explained that in group 2, the disc edema can be due to the bilaterality of ocular trauma, which disappeared by 2 months, and the exact origin may not be diagnosed by an MRI or CT brain at the time of presentation. Incidence of RAPD, 21 patients presented with RAPD in group 2, whereas 42 patients presented with RAPD in group 1. Visual outcomes in patients with RAPD was analyzed, in which the 21 patients in group 2 who presented only with an ocular trauma had an intraorbital or canalicular portion injury in the optic nerve, and orbital nerve decompression was also carried out, but 3 patients did not show any improvement. We also, as previously mentioned, we analyzed whether bony orbit involvement has an impact on the visual acuity improvement. In group 1, it was a blowout fracture being the most common, and in group 2, it was medial wall fracture, and the table also shows the percentage which showed a visual acuity improvement. Also, we analyzed the visual outcomes versus lead involvement in both the groups, which shows that 56 and 74% of the patients respectively showed an improvement in visual acuity. Coming to the discussion, presence of head trauma in patients with papilledema was a poor prognostic factor. The presence of RAPD in patients with head injury had poor visual outcomes, and the results were statistically significant. In our study, we also found that bony orbit involvement, though it affected the visual outcomes in both the groups, but the results were statistically insignificant. And as previously mentioned, lid injury did not have any impact on the visual outcomes. That is, patients improved with a good visual acuity. These are the take-home messages from our study. We conclude that head trauma, when it happens along with an ocular trauma, has an important prognostic significance. We used GCS as a scoring to assess the general prognosis. Presence of papilledema in the presence of head injury in patients with ocular trauma is a grave prognostic factor. RAPD in association with head trauma is a more ominous sign. Bony orbit involvement, if present along with head injuries, though it decreases, but in our study it was statistically insignificant. Lid injuries does not decrease the visual outcomes, whether there is a concomitant head injury or not. So we conclude that papilledema, RAPD, and bony orbit involvement are the factors which predicts the visual outcomes who had a concomitant ocular trauma and head injuries. These are my references. Thank you.
Thanks a lot for the second presentation. I was chairman for both the sessions. They'll be giving the marks, we'll notify you. Thanks a lot.
Thank you, sir.
Any questions you'd like to ask, both of you?